Hi, I'm Yael Greenblatt, and in this video you will learn strategies to help make nutrition education more meaningful and effective, so you can help make a difference in the health of your community. Nutrition education has historically been didactic, which means it takes on more of a lecturing style and is usually not the most effective format for delivering nutrition education. This is because it doesn't always capture or maintain people's interest. In order to create change in your health behaviors, you need to feel empowered by having new experiences and acquiring new skills, like learning how to prepare a new recipe. WIC has been exploring several tools and approaches to optimize nutrition education in order to improve overall nutritional status and to decrease the incidence and prevalence of obesity in low-income families. Motivational interviewing is a client-centered counseling technique designed to elicit clients' personal thoughts and emotions regarding particular behaviors in order to determine a goal for change. The skills associated with motivational interviewing are designed to facilitate effective communication between clients and staff. A study conducted by Marley et al. Found that training staff to use motivational interviewing significantly improved their counseling self-efficacy, which is the belief in their ability to effectively counsel clients. Another study showed that adding a motivational interviewing component to a routine WIC counseling session had a significant impact on children's TV watching and fruit intake behaviors. However, the intervention group did not actually improve their behaviors, but maintained them closer to baseline, while the control group's behaviors worsened. To help make motivational interviewing more effective, 2 sets of innovative counseling tools have been developed to facilitate meaningful discussion between clients and staff. As part of New Mexico WIC's Get Healthy Together project, 4 counseling tools were implemented to help staff address a child's weight status with caregivers during the counseling session. The Healthy Weight poster is meant to visually communicate the concept of a healthy weight to clients.
This one.
That one. Why do you pick that one?
Because he looks a little smaller. I mean, that sounds bad. And he looks a little bit more healthy.
That one.
Why would you say that?
Kid's a little bit more like the heavier side.
The other kid is?
Yeah, he looks more out of weight.
Mm-hmm.
Well, this one would be my first thought, but
Okay.
even though he's heavy set, that doesn't mean he's not healthy.
Okay.
I mean, he could still be healthy. Just
If this was on a WIC clinic wall, would this be something you'd look at and would be helpful to you?
No, not really.
Okay.
This kind of catches your eye a little bit, but then down here you kind of just, it looks like you're comparing people, and then a lot of people just wouldn't really look at it.
Like seeing.
Yeah, they wouldn't really think too much of it.
it'd make me curious as to if my daughter was, healthy, or if she was underweight, if she was overweight. It would just make me think about that in general.
There's a lot of posters that don't. You just kind of look past, and they're talking about the same thing, or healthy food. So definitely.
And this one's different because it's
Showing children, and you don't want to compare your children to a poster.
During the counseling session, WIC staff use a tool called the Report Card Action Plan, or RECAP, which provides a visual summary of the child's health status, including height, weight, hemoglobin, and BMI.
I guess that's his height that we took today, and his weight, which puts him at the 85th percentile.
WIC staff rated this tool very highly in terms of helping them counsel clients about their child's weight. They said the most useful feature of this tool was the ability to point to where a child's BMI percentile fell on this color-coded bar.
This is where he would fall between, and
This allowed WIC staff to describe a child's weight status without having to use the terms overweight or obese. Clients often perceive these terms as stigmatizing and cause them to become less open to discussion. The motivational interviewing skills acquired by staff allowed them to ask clients to describe their reaction to the location of their child's BMI percentile on the spectrum. WIC staff thought this was a non-threatening approach to allow clients to describe their feelings associated with their child's weight. It also ensured that the discussion was client-centered and based on the client's reactions and not on the WIC staff priorities. On the back of the report card is the action plan that includes a family health goal that clients and staff made together. To help clients develop a health goal, the staff used the Talking Tips tool, which contains 7 images of healthy behaviors to help a client select a behavior change goal. And each of these categories corresponds to the goals on the action plan card.
Watching less television,
Yes.
TV viewing. How much do you want to limit it to, like in a day?
Maybe 2 to 3 hours.
2 to 3 hours.
And that still sounds like a lot.
How do you think you might reduce him watching television?
And that's the problem, 'cause I don't know. We do have a pool in the backyard, and I've been taking him back there.
Good.
So,
Very good.
it's just hot in the middle of the day,
Yeah.
so that's the part I don't like.
Findings from these studies showed that counseling on childhood obesity is very difficult, and many staff felt like they could comfortably discuss a child's weight status with their clients after acquiring the appropriate tools and training for discussion. However, it is still unknown whether discussing a child's weight during a counseling session makes any difference in their health or weight status. More research is needed to answer this question. The Get Healthy Together tools are available in English and Spanish for free download. Massachusetts WIC created the Touching Hearts, Touching Minds nutrition education. The logic of the emotion-based materials is that parenting is an emotional experience, but the traditional materials given to clients are often very factual, dry, and devoid of emotion, and may not resonate with mothers because of this. You may be more likely to influence healthful behaviors in clients by taking on an emotion-based approach, similar to what advertisers use. Study findings showed that clients preferred the emotion-based handouts over the traditional handouts in Massachusetts, although a few clients in Arizona had a different opinion.
I would probably end up going with this one because it looks a lot more simpler and easier to go by.
Okay.
And this one is like a lot of reading. So I'm a lazy person, so I would really go by this one.
I'd want to know the facts.
You want to know the facts?
Yeah. I mean, you can hear stories from anyone. You don't have to read about it on a piece of paper, but no, I'd want to know facts.
I like the tips, and it's only because it gives you an accurate amount of cups of how much vegetable, fruits, grains, dairy, protein, important things that maybe the average American wouldn't know.
I do both of them, but just because this one tells, her story, but then this one also tells, gives you tips and tells you what you can do.
To complement the handouts, emotion-based counseling tools are used to engage clients in discussion.
As you can see, I have a bag here with different fabrics and textures. Reach in and pick one that says something about how you feel about mealtime with you and your family. Tell me a little bit about what that fabric says about mealtime.
Well, it's smooth, but there's some bumps.
Okay.
I feel like it's better now. It was hard earlier in the pregnancy, but I wasn't feeling well. But now I feel like I can eat with my family, though Xavier doesn't eat as well.
I'm going to show you some images. Okay. And I'd like you to take just a moment to look at the images and see which one best describes the way it's, what it's like to feed Andrew. Okay. Okay.
I'd have to go with the boxing gloves.
Ooh, okay, the boxing gloves. And what does that say to you?
He fights me on certain things, so he loves cheese and yogurt, fruit. But when it comes to vegetables, he won't go anywhere near them, and he's picky about meats too.
Similar to the Get Healthy Together counseling tools, more research on the emotion-based nutrition education materials is needed to determine whether this approach makes any difference in a child's health or weight status. There are currently 30 emotion-based handouts and 30 counseling tools that are available for free download. Client-centered education is typically done in a group class setting, similar to facilitated group discussions and peer support counseling groups, where clients are encouraged to engage in discussion. compared to a didactic class where clients sit passively and listen. Client-centered classes that involve cooking demonstrations and food preparation strategies are helping clients learn how to prepare their own nutritious meals and snacks. Studies investigating the effects of providing client-centered classes on topics such as food shopping and preparation strategies found significant impacts on clients' self-reported intake of nutritious foods. The main barrier to widespread implementation of client-centered education is the high cost of additional resources, such as increased staff time, larger facilities, and new educational materials. Technology-based nutrition education, particularly online education, is another educational approach that is currently being provided to WIC clients in 23 states through a website called wichealth.org. This is convenient because clients are not required to travel to a WIC clinic to receive their nutrition education, which may be a burden for working clients who may only own one car or no car. One of the newest features of wichealth.org is the Health eKitchen resource, which allows clients to tap into a collection of videos focused on shopping, preparing, food safety, cooking, and storing foods found in the WIC food package. The main goal is to help clients become more comfortable in the kitchen. Findings from 2 studies showed that wichealth.org is a viable method for impacting movement along the 5 stages of change for a number of parent-child feeding behaviors. Based on the current literature, the most effective approaches to nutrition education are client-centered classes that provide education on food preparation and online nutrition education using wichealth.org. Based on the current literature, there are only a couple of studies involving both of the clients and staff in choosing formats and delivery methods of WIC nutrition education. We wanted to know what kind of nutrition education clients were looking for, so we conducted a series of 10 focus group discussions with WIC clients and staff at Pima County WIC clinics in order to understand their perceptions of the current format of nutrition education in WIC and to solicit suggestions on how to enhance nutrition education. We found that across 10 focus group discussions, clients were most interested in learning how to prepare healthy meals and snacks for their children, creative methods of nutritious food presentation, and more fresh produce in the food package each month. The favored formats to receive this information were videos and live cooking demonstrations. We decided to talk to a couple of experts in the field about their recommendations for enhancing nutrition education for clients.
Coming with fun little educational aids is the best way to really engage participants and to provide participant-centered education. And so we'll bring education aids like this, which what you're seeing here is we have some jewel cases that are filled with different whole grains. And they're done sequentially so that you start with like a wheat berry and then ground up is the whole wheat flour and then white flour. So you can have that conversation about, well, what is a whole grain? And these are very inexpensive, so you can make several sets and pass them out so that all of your participants, even if you have a class of 30, that everybody can sort of be sharing and have eyes on what it is that you're talking about. But just allowing them to kind of touch, just like all of the best teachers in schools with kids. When kids, they're tactile, when they can touch something, experience it, they're going to commit it to memory. It's just a completely different experience than just sitting and talking about coriander, but not being able to see it. Some of the most successful programs are the ones that really engage the participants in more of a conversation, and the educator brings a piece of themselves to the class. I understand that you have your own experiences in life and I have mine, and let's share together. And sometimes that's when the best learning occurs, is when participants are teaching others, and we're there to kind of guide the conversation a little bit. The world of food is so big, and there's always something to learn, and if anything, it should always remain exciting. And that's the beauty of it, is that when you you start to share about how delicious food can be and how you can prepare these really wonderful meals at home for low cost. It just sort of spreads that energy, and then your participants start to pick it up and try these things as well. Currently, we're offering food demonstrations, 1-hour food demonstrations on Saturday mornings. They're open to the community. We advertise to our low-income participants as well that we see throughout the week at various sites. And the format on our Saturday classes is a 1-hour food demonstration where you have a chef up in front of the audience, and they're preparing recipes from start to finish, and it's usually 3 to 4 recipes. These types of recipes that we promote are usually 10 ingredients or less. They're going to be items that aren't hard to find, aren't very expensive, and they're not going to be recipes that require any cooking skills that are overly complicated. And the benefit of taking the participant from start to finish with each recipe is you get to discuss all of those steps along the way that they may have questions. And so when you're going through the entire process of a recipe, you can really talk through the practicality of, well, how do I do this when I'm at home and this is my cooking situation, or I only have a hot plate, and that allows you to customize it to their needs and what they're going to see in their own environment at home.
And how well do you think the Garden Kitchen meets participants' nutrition education needs? Do you think people are going home and cooking as a result of these classes and applying what they're learning?
Yeah, so the feedback that we get whenever we do food demonstrations and even some of the sampling or the interactive lessons where we're bringing in different food items is astounding. People are having a great time. They're really enjoying themselves. They're learning lots of new things that they weren't exposed to before. And you can see that when they're asking questions throughout the class. You can see that when they come up to you after the class to say, I really want to try that specific bean. Do you have a recipe? When you see that intrigue and they're ready to go home and start to make something, and they're leaning on you as a resource, you can tell that it's really made an impact. And so one of the new ventures for the Garden Kitchen is to actually put in kitchenettes. We're going to put in 5 of them, and they're fully functioning kitchens. They're sort of a mini size, but they have everything that you need, similar to what you'd have in your home environment, so that you're kind of accustomed to, okay, I have the sink, the stove, the microwave, all of those types of things, and that'll allow us to provide a demonstration of a specific recipe that we'll be making, a healthy recipe. So participants become accustomed with the full process of preparing a healthy meal. So the groceries will be in their refrigerator ready to go. But other than that, they need to be able to wash the produce, break it down, prepare it, serve it, and then clean up afterwards. So they have a real sense of what's it like to prepare a meal on a daily basis. And then we can have those conversations about, well, here's some things you can do to cut corners, or to make more on the weekends so that you have something lined up for weeknight dinners. And then participants can go into the kitchenettes and they can practice. And this is a really wonderful opportunity to encourage families to cook together with this support and assistance of educators who have some cooking background and can help you with, how do I get my 12-year-old involved in the cooking process? Well, she could tear lettuce, she could open the cans, getting the participants up and involved in the process, showing them how to do it, all of the steps, and then getting them up and getting them involved in the process. Because hearing is one thing, but practicing is another, and that's when you really commit things to memory. So when you give them the opportunity to prepare the recipe in front of or with the support of staff, then you just build their confidence and they go home feeling like, I've got this, I can do this. The Garden Kitchen has been moving into trying to create more videos. We've created about 3 at this point. It's something that we look forward to doing more of in the future because we really see a need. Our goal is to serve all of Pima County and really to provide resources to other organizations just like us that are trying to educate the community about healthy eating. We did a WIC project where we created healthy snacks. We did a video with healthy snacks, and we've also worked with the Pima County Cooperative Extension to create a video about knife skills and on food safety, some of the basics with cooking. There are a few resources like this that are out there now. I think we're going to see a lot more over the next 10 years as everyone kind of clues into this is a really great way to reach people, like you mentioned. It can also just be a mom trying to think of how to prepare dinner one night and Googling cooking videos. And there's not a whole lot out there right now, but there's starting to be more. And there's a lot of support for it. Because it's a great opportunity to meet people where they're at and when they're ready. So whether it's 10 o'clock at night and someone's curious about how to create something healthy, or they just got back from the doctor's office and they're feeling really motivated about it, is there anything online that can kind of take that initial motivation and sort of springboard them into cooking?
As far as access to affordable, nutritious foods go, before we even educate clients on nutrition education and cooking, we need to make sure they have access to the right kinds of foods. So do you have any suggestions for organizations in the community that could provide inexpensive, fresh produce for clients and for people?
So here in Tucson, we have an organization that rescues produce from a food bank and actually brings it every Saturday to different locations in town, and community members are able to purchase 60 pounds of produce for $10, which is just phenomenal and a really great way to make sure that you're getting enough fruits and vegetables in your diet. And then pairing that with programs like the Garden Kitchen or other programs that have recipes that can tell you, well, what do I do when I have 60 pounds of squash? What can I do with this?
I think it's important to have partnerships when we do these education programs. Not one program can do all the education.
Absolutely.
So if you're going to give a recommendation to a public health person in another state, how will you talk to them about creating the best types of partnerships? What do they need to do in order to have those teams work together within the community so we can do more food-based education?
Yeah. So I think my number one suggestion, the place that I'd say everyone should start, is first kind of do an assessment. Are you knowledgeable about what's in your community? What resources are out there? What organizations are trying to provide similar education or working with the same participants that you're working with? And so what resources do you have and what resources do they have? Because a lot of times they have goals like, we want to change the food environment in our organization, and you can be right there to support those kinds of goals. And so it may not be that, one organization you meet is going to mesh with your organization, that you're going to be able to provide services, but you probably know another organization that you could help them out with. And so you start to develop this community where everyone's helping each other to achieve the same goal, and that is healthy communities.
We need to do more food demonstrations. That needs to become part of our nutrition education that's been missing because they don't have it in school anymore. And so where people are learning it. And if you skip the generation of cooking, they don't have the role models. Maybe the role models is a grandmother, but if the mother's not the role model, then that person's becoming a young adult, they have no experience, no exposure to it.
And the cycle of obesity is just repeating itself.
That's right. And being able to cook at home, the data is really clear. The more families eat together and cook together, the less obesity in those households. And that's when we're trying to prevent childhood obesity, we need to figure out how to get the kids into the kitchen with more time. I think people, no matter where they're located, they need to find out where these demonstration kitchens are. They're in every state. They're in urban areas. They're in rural areas too. People can find who their partners are to say, can you help us do a food demonstration?
We've seen the types of nutrition education that are most desired and effective based off current research. We showed you examples of organizations which are currently using effective nutrition education. There are many different effective options available. Now it's up to you to find collaborations to bring the most effective nutrition education to your clients so you can do your job to fight obesity and make a difference in people's lives.